Hey, welcome to the channel. We hope that you enjoy today's stories and check out the chapters on the video to see all the stories for today. But before we get into this video, subscribe to the channel and hit that bell icon to get notified when we release a new video. So let's get into the video. Male gynecologists of Reddit, why did you pursue your job?
Experience 1. I get to do a nice mixture of office, surgery, and labor and delivery, which is its own unique thing. I like the busyness and the high intensity. And I like being a part of one of the biggest days of people's lives. The hours could be better though. Babies have no respect for other people's schedules. Experience 2. Male OBGYN in my 30s from Europe here. Several reasons, but maybe the most important and formative experience for me was when after med school I was living in the Horn of Africa for a couple of years. I witnessed some soul-crushing things, like obstetric fistulae, young women with advanced cervical cancer that could have been prevented easily, victims of sexual violence, and complicated and traumatic deliveries. To put it mildly, women's health leaves much to be desired in a global context. I also met there some extremely inspiring and charismatic people like Edna Adan Ismail and Catherine Hamlin. In general, I'm usually not very easily captivated by people, but these women were just something else with their endless kindness, charisma, and altruism. If on my deathbed I could say that I spent my life trying to do what they did, I could die peacefully. So, when I, as a young doctor, had the opportunity to get training in the most important medical specialty of all and do my small part in making the world a kinder place for women, who really would need to think twice. Edit. Since the thing about obstetric fistulae caught some attention, I'm just using this visibility to say that if you want to support the work these people helping women suffering from obstetric fistulae do, you can donate directly to the Hamlin Fistula Hospital in Addis Ababa, Ethiopia. The work they do is truly amazing. Experience 3. Originally didn't know what I wanted to do when I entered medical school, and if you had asked me, OBGYN was at the bottom of the list based on everything negative I had heard. Third year rotation was really surprised at how much I enjoyed it. You get to do a little of everything: medicine, surgery, primary care, office procedures, and obviously delivering babies, which was awesome. On top of that, I lost my mother during medical school, who was my biggest role model. Being able to be there in the room with new moms during their happiest moments just kind of made it all click for me. Don't regret my decision at all. Experience 4. I'm a male gynecologist of 6 years. Albright working in a hospital outside the US. During our education, we do rotations in every field, and gynecology was one of the most diversified fields. I'll do deliveries, small operations, DNC, or laparoscopic surgery, as well as bigger stuff. Here we even do breast surgery and administer adjuvant chemotherapy ourselves. So, I get to do all the fun stuff and it never gets boring. Sorry to everyone thinking I'm looking at vulvas 24/7. Most of what I do is talking, to be honest. If you got more questions, I'll do my best to answer. Got to bring my daughter to bed now. Experience 5. It felt like an extremely well-rounded profession. You get to do inpatient and outpatient. You get to do office procedures, laparoscopic surgery, robotic surgery, vaginal surgery, and open surgery. You get to do a hands-on ultrasound and not just read it. You get to deliver babies. If you're doing GYN-ONC, many will do the chemo and the surgery, and not just the surgery like surgeon ONC. If you do MFM, you get to do ultrasound-guided procedures such as fetal blood transfusions and such. I feel like this thread wants to focus on the discrepancy between physician and patient sex/gender. We are physicians who take care of patients regardless of their demographics/characteristics, and the profession itself can have high acuity, high points, and low points. You are caring for vulnerable populations, and it is rewarding. Edit. The other question we always get is, don't female patients prefer a female physician? Many do. And that is great. I want patients to see whomever they feel comfortable seeing. I ultimately find that 99% of patients want someone who is going to take care of them as a compassionate and empathetic physician, and this transcends what the race or sex or gender, etc. of their physician is. Experience 6. Male OBGYN here. Lots of reasons. I am genuinely excited every time I get to be part of bringing a child into the world. As a dad to daughters, I feel responsible for making the world a safer place for women to seek health care. Women's health is full of mystery, which isn't the case in more studied clinical areas. Some reasons for this include women's health only getting about 1% of biopharma research funding, women being excluded from clinical trials until 1993, thank you thalidomide scandal, and research animal models almost exclusively being male until 2016. There are common women's health problems, like endometriosis, 10% of women, which we simply do not yet understand. As an academic, I love the research component of my job. The list goes on and on. In short, I think it's the most rewarding area of medicine and wouldn't do anything else. Experience 7. I played football in college. Offensive line. Burly, bearded, white dude. Everyone had me shoehorned for orthopedic surgery or sports medicine. I hated them both. Loved being in the operating room, so I knew I had to do a surgical specialty. General surgery rotation was very abrasive where I went to school. I had ruled out the other specialties for one reason or another and was left with urology or gynecology. Urology was too competitive for me, so OBGYN it was. I also had a very, very good friend 4 years ahead of me, so she was just about to finish residency when I started. She mentored me and actually took a position as an attending where I matched for residency. I absolutely love what I do. I have a truly amazing team right now between my scribe, my nurse, the surgeon techs, and the LDR girls. It's a great job. Experience 8. I think it's one of the most generalist areas of medicine still around. You dual specialize, at least where I practice, so you get to do both obstetrics and gynecology. With gynecology, you deal with both medical and surgical issues, things that may have been dismissed for ages by other doctors where you can make a difference, or things where people are truly worried they are not normal when they actually are. You deal with sexual health, cancer, chronic pain, and fertility issues, to name a few. A lot of treatments can be medically based, but surgery is occasionally used. Communication is key here, and teaching the patient about the condition is paramount to helping them deal with it. I enjoyed palliative medicine as a young doctor, and early pregnancy issues like miscarriage allow me to look after a family unit in a similar way, as does later losses from an obstetric point of view. Surgically, you can do open surgery, laparoscopic, vaginal, plastics, Rogaine and general, robotic, etc. Your work can be elective or emergent, and ruptured ectopic or hemorrhaging miscarriages can be the most urgent of urgent, allowing you to save someone's life very quickly. With obstetrics, you can deal with any medical issue, with help mined from other specialties, as your population of patients can have pretty much any medical disorder. You get to watch a patient move through their pregnancy and can even support and deliver them if it is needed. The emergency component in obstetrics is broad and frequent, and these are usually easy to deal with. However, the skill comes in communication in these fraught scenarios, which can make or break a patient's experience. There's also a safeguarding component, as women are more likely to suffer from domestic abuse, especially so in pregnancy, where you can make a massive difference in that patient's life. Overall, you deal with young, old, normal, abnormal, cancer, STIs, life, death, grief, happiness, fear, and support. A vagina is only part of it. There's a uterus, ovaries, hormones, and a completely whole person that I treat.
Do you like listening to these stories? Do you want to hear more of them? Then click that like button, subscribe to the channel, and hit that notification bell. And check the description for links to more videos and interesting stories.
Experience 9. To people outside of medicine, this is a common question. And it's usually included with something along the lines of, how can you effectively care for women with women-specific issues if you haven't experienced those yourself? Seems like a very reasonable question. But it's helpful to remember that most oncologists haven't gone through cancer treatment. But they're still well equipped to guide someone through cancer care. Sure, the patient might benefit from talking with someone that has been through it, but that's a good role for group therapy or a support class. Doesn't have to be a role that's filled by the doctor. Most surgeons who fix heart valves, take out gallbladders, remove tumors, etc. have never had heart problems, gallbladder problems, or a tumor. It's not necessary to have personally experienced those things in order to be excellent at taking care of those things. Where we run into trouble is when men dictate the care of women. But doctors shouldn't be dictating anyone's care in this day and age. Patients should be provided with the resources to make their own decisions. For women seeking care from an OBGYN, the best equipped OBGYN is the one that can listen, make a logical plan, advise their patient of their options, and respect their wishes. That OBGYN could be a man or a woman and be equally good at those things. Experience 10. Male OBGYN here, with a post on fetal medicine, sexology, and a fellowship in fertility/reproduction. As others have already said, OBGYN is an extremely diverse field with always a lot going on. There's a major surgery to be done, then you're off in an office talking about anything, then on an ultrasound machine performing morphology checks, and then a phone rings and you're over there helping bring someone to the world. It's all very engaging, emotional, and rewarding. But for me, the core of it comes directly from its literal meaning. Obstetrics derives from the Latin obstare, which means to be by the side. It's also an emotional roller coaster. I get super elated from birth and have and will continue to cry with my patients during a miscarriage. But have you ever seen the gaze of a mother to her newborn son for the first time? Have you experienced the pain that comes with the loss of someone who's never ever been born? I get to see the joy of a cancer-free patient. I hear the sweetest sound of a baby's first cry. I even made a blind lady see her baby during an ultrasound exam once. I get to work with amazing and caring people like Kipros Nicolaides and Eve Ville. I do good for the people around me. It makes me feel proud and accomplished in every way. What else is there to say? Experience 11. People who think it's to look at vaginas all day don't realize in a professional medical setting, looking at genitals for a doctor is the equivalent of a mechanic looking at another motor. Nothing sexual or arousing about it. Many people I know have reduced sex drives while working on their OB rotations in school because it's just another vulva. Experience 12. Seems like most of the comments are just from people who know someone. Actual male OBGYN here, for almost 20 years now. Live my job. Hours suck sometimes, but I'm doing something I enjoy. Get to do primary care, get to do surgery. My first revelation in med school was a lot of fields have a few things that are the bulk of their time, basically their bread and butter. Primary care? Lots of diabetes and high blood pressure. General surgery? Bowel resections and gallbladders. ENT? Tubes and tonsils. Loved cardiology but couldn't stand the thought of doing 3 years of internal medicine or pediatrics to get to the point. But in OBGYN, every day is different. Surgery, office, labor, and delivery. Most of my patients want to be there because something is happening that they wanted, not have to be there because something is wrong with them. We help many people on some of the best days of their lives, but also help them through some of the worst. And my work is constantly under attack at this point. I'm in a red state, and I know people are leaving, but I stay behind because my patients can't leave, and I can't abandon them. And if I can use my privilege as a middle-aged cis-het white male to get someone to listen to the impact of their decisions on my patients, I'm happy to do what I can. Experience 13. I'm a male MD working right now at a family practice here in Sweden, but considered OBGYN seriously for a while and worked at a women's clinic for a short time. Medically, it's the perfect sweet spot for a person who wants to do it all. You get emergencies and saving lives on a daily basis. You get really cool surgery ranging from real emergency life-threatening operations to long cancer operations. You are almost an endocrinologist, a geriatrician, a pediatrician, and a therapist all at once. You get to meet life and death literally all the time. I have seen and assisted a fair number of deliveries and seen the joy and pain in the parents' eyes. I have held an older patient's hand while consulting them, telling them that the cancer is inoperable and that there isn't anything more we can do. It's just a wonderful specialty overall. Experience 14. I, male, used to work as a prenatal chemist. This mostly meant screening amniotic fluid and blood serum from pregnant people to detect chemical signals which could indicate an issue with the pregnancy. The first few times, I was like, this stuff is from a uterus? That's so weird, but then it just became another bodily fluid. I took the job simply because it meant a raise, I could do the chemistry, and handle an immunoassayer. The real issue was getting the occasional male trainee who had the sort of cultural background which made him unable to discuss or learn about in an entirely clinical context important things like gestational age calculation by last menstrual period versus ultrasound.
We hope you enjoyed listening to today's stories. If you want to see more stories, check out these videos or check the links in the description for more videos. And don't forget to like the video and subscribe to the channel. And ring that notification bell.